Hello, hello, hello. Welcome to another episode of Diary of a Professional. This is Ashley,
Hello.
and we have our lovely guest today, Alysia Dagrosa, endometriosis advocate here. And before we get into our topic, let's go into our gratitudes. Marley, would you like to go first?
Sure. It has been quite the hectic week, but I am grateful for my supportive village who have been there for me, who have just rallied behind me. And it's just like, okay, I'm gonna get through this. Like, I even shed a couple of thug tears, and I was just like, okay. The fact that I had like a list of people I could call from was like, that could be reason enough to cry. But so I was just thankful for them, and so getting it together. So
I love that. It's so good to just be able to have that ecosystem of family, friends, or whoever you can like lean on to, confide in. Yeah, I hear that. Speaking of support, I guess I'll kind of segue in regards to support. Yeah, I'm grateful for being there for people who I love the most when it's needed. You know, I love being able to understand them in a way, to give them grace the way they need during certain times of their lives, and just helping them, I guess, during difficult stages of their life or journey at this point in time. So I'm kind of grateful that I can
yeah,
be
that
a
is a
supportive
blessing too,
person
because
to
that means
those
like
people in my
someone trusts me with their
lives.
emotions and their feelings and their experiences. So it's a blessing to be that as well. Love it.
So I guess it's my turn, right? So what am I grateful for this week?
It is, honey.
I'm gonna go ahead and say God's timing, because there were a lot of things that I've been working to get sorted, to get together throughout the whole pandemic, and things are like finally coalescing. Fine, like, things I've been praying for, been asking for. And his timing is always right. So I never thought he was late, or, I was like, all right, the answer to this is gonna come at some point in time. And I've been getting a lot of answers this week. So
Ooh, love that.
I love that. I love that. Yeah, it's so interesting because sometimes we're there, we're praying, and we're like, God, like, okay, we praying, we know it's coming, we know it's here, and you're just silent, and you're like, when is it happening? And you're like, wow, it happens just always on His time,
right.
and it's usually just the right time, you know.
Mm-hmm.
So I love that. I do love
Good.
that. So I wanted to go into our topic for this episode for Women's History Month. It is also Endometriosis Awareness Month, and I definitely want to bring awareness to that. So I wanted to bring to light this condition just because it's more prevalent than people may think. And many women do deal with this more than we think, and we don't even know. Many of us are undiagnosed. And I do feel like there are times as women, we kind of get pushed to the side in regards to our complaints. And especially when it comes to menstrual disorders as well, it's like as if like, oh, it's okay, or it's all right, or try this, take some Motrin and all that a day. So I definitely wanted to speak with Alysia today in regards to that. So can you tell us a little about who you are and a little bit about your endo journey?
Sure. So my name is Alysia Dagrosa. Lots of people call me Tanty Liss. I'm West Indian, so I've become the village Tanty. I'm a board certified patient advocate, and I'm also a full spectrum doula. In regards to my personal endo journey, I first started having symptoms right at my very first period at the age of 12. After a harrowing summer at 19, I finally was diagnosed with endo. It was the first time I was, even told that word, even though I'd been symptomatic that entire time. I was given very poor options. They were like, well, you have endo, so you can either go on birth control or get a hysterectomy. You're only 19. You don't want a hysterectomy, right? And I was like, no. So I went on birth control. And that kept the symptoms at bay for a short while. And, it got worse, it got worse, it got worse. And then I finally got access to proper care at the age of 32. So if you were keeping track of that math, that's 20 years. That's 20 years. And that's 20 years too long. That's unacceptable. The average to diagnosis is 8 to 10 years, which people talk about a lot, but a lot of people don't talk about the year gap between diagnosis and proper care, which, as you see, for me was quite long. It was 12 years. And I felt, that was completely unacceptable. And once I was given the information, once I knew the information, I couldn't keep it to myself. I was like, I felt like almost guilty. At first, like when I was healing, people were like, you should be an advocate. You talk so passionately about this. And I was like, oh, I don't know, because I was still healing. But then, after I was done recovering from my surgery and everything, I was like, no, I need to share this. I need to pass it on and help others. We're called to be, the salt of the earth, the light of the earth, and bring that light to others while they're in their darkest times. So that's why I do what I do today.
I mean, I'm sorry, call me crazy, even as, a healthcare professional. I don't know what endometriosis is. Can we start there? Can you give us like a basic layman's definition and understanding of endometriosis?
Sure. So one of the big reasons why the healthcare situation is so poor for endometriosis patients is because it's misconstrued as a menstrual disorder. While there is some connection to your menstruation and a lot of your symptoms are cyclical, it's not within the uterus, it's not of the uterus, it's not of menstruation, which is why hysterectomy doesn't work. So let's start off with the correct definition of endometriosis. Endometriosis is systemic, it is body-wide, it is inflammatory. The only thing that is similar to anything to do with the uterus is that when you look at the lesions, the endometrial lesions, the cells are similar to the endometrial lining. So when they were first discovered, they thought it was misplaced endometrium, but it's not endometrium. It is simply similar in appearance to the endometrial lining of your uterus. So let's start there. So we know that Samson's theory, the theory of retrograde menstruation, it's been debunked. It's over 100 years old. So what is retrograde menstruation? About 90% of menstruators have some level of retrograde menstruation. Why? Because your fallopian tubes are open into your abdominal cavity, right? So if you're laying a certain way, if you're upside down and you're on your period, some of that blood is going to backflow into your abdominal cavity, into your pelvic cavity, right? What's the prevalence of endometriosis? We've been saying 1 in 10 for a long time. Now that we actually have a little bit more research dollars, it's closer to 1 in 9. Okay? So we're talking about around 10% of the population, which is a lot, but it's not 90%, which is the number of menstruators that have retrograde menstruation. So we know retrograde menstruation is not the cause of endometriosis. What is the cause of endometriosis? Endo is essentially a birth defect. It happens in utero. If you've ever seen those diagrams of how a fetus is developed, you start with a cell division, and then you get, and then all of a sudden you get from cells to fetus. And it doesn't explain to you in those diagrams how you get from cells to fetus. So at around day 10, there's something called differentiation, right? So there are main stem cells, and there are 3 different kinds, and then they start to differentiate for each organ in your body, right? The gonadal stem cells, which create the reproductive tract, whether you're a man or woman, are what cause endometriosis. They come in a spiral-like pattern. So imagine like this is your rudimentary form body, and this is where your head's going to be. And in a spiral-like pattern, those gonadal stem cells. So imagine in your head, Pocahontas, leaves, color spinning around, right? When you see leaves spinning around, most of them get to their endpoint, but some of them spin off, right? And don't make it. Those random leaves that spin off, those are the gonadal stem cells that spin off from the main cluster, and wherever those stem cells land, turn into endometriosis. And that's why endometriosis is not a disease of menstruation. It is not only a woman's disease, because while we mainly have it, you can be a man and have it, you can be trans and you can have it, anyone, you could be asexual, anything, and you can have endo, because that system happens to everyone. The reason why you see more prevalence of it in the female population is because when you start your menses, you have this explosion of estrogen. Endo feeds off of estrogen. And the menses is the catalyst that starts the symptoms. So in cases of men having it, you'll usually see it when they're having cancer treatments and their estrogen levels skyrocket. And then and when men get it, they're diagnosed within 3 months flat. If you look at the case studies of when men get endo, they get diagnosed like this.
I wonder why.
Like this. Right. So once the endometrial lesions are activated by this cataclysmic event of menses, they no longer need the uterus. They then, so the lesions and nodules are created of stroma and glands and stroma. You'll always hear endo experts talk about glands and stroma. Those glands excrete their own estrogen, so they feed themselves. So if you cut out a woman's uterus for no good reason, it doesn't matter, because those endometriosis lesions are going to sit in your body still and feed themselves. You're not going to have these big flare-ups during your period anymore, but it's still going to be there. The disease is progressive. Those lesions are going to continue to eat into whatever they're sitting on. And now you lost your uterus for no reason. And the uterus isn't some throwaway organ, okay? People think it's just for having babies. All kinds of things happen to you after you lose your uterus. And it's not just about bone density. There's cognitive decline. There's all these, your skin, all kinds of things happen to you after you lose your uterus. It's not just like, we are not baby making factories, okay? Where our purpose on life in this world is not simply to make babies, okay? We have so much more work. I hope people hear that outside of that. And you know,
the back, the middle.
Because I have gone to endometriosis seminars and medical conferences all over the world. And there are certain countries that I will not name. They don't care anything about your quality of life. They just care about how many babies you produce. And so their main thing is IVF. Let's IVF around the endometriosis. You can't IVF around the endometriosis, number one. And number two, like I said, our purpose isn't making babies. The endometriosis isn't a barrier to baby making. It's a barrier to a good quality of life.
So I wanted to speak about that. What are the challenges you experienced with healthcare professionals trying to find this diagnosis? Because it was such a big gap, like 20 years, So I'm just wondering, what are the challenges you faced to get to that diagnosis?
So I was so symptomatic at a young age. People don't believe teenagers when they say things. You grow up, people don't believe you as a woman when you say things. People think you're overreacting, you're dramatic, you're why are you acting like that? It's just a period. Everyone has a period. Like what's wrong with you? You can't handle your cramps? What's wrong with your pain tolerance? And then I had surgery, and I went around Brooklyn to because I had my surgery in Atlanta. When I came back to Brooklyn, I had all my papers, my surgical reports, my images. I showed them to every single doctor because they all wanted to do post-op appointments with me. They looked at the pictures and their eyes went like this. How were you alive? Oh!
Mm-hmm.
Oh! Oh, now that you can see it. Now that you can see it, you believe it. But because all that stuff is going on the inside of you and they can't see it, they think you're a drama queen. I don't know if you guys are watching my post about Marilyn Monroe this month. I'm featuring Marilyn Monroe. Poor Marilyn. Poor Marilyn. And this is going to be a little bit of a sneak peek to further posts in the month. But poor Marilyn was hospitalized in mental institutions multiple times because people did not believe that she was sick and thought she was making it up.
Even know that Marilyn.
And she's a white woman.
And a well-known popular one.
I didn't even know she was struggling with this. And the multiple, reading your post and watching the multiple hospitals she went to for interventions as well. Yes.
You saw that? And she was struggling from when she was quite young. And everyone just said, "Oh, you're so dramatic. You're a diva." I had a lot of I've been told that many times too. "Oh, you're so sensitive. You're so sensitive. Oh, we must baby you because you're so sensitive." But not actually babying me, just like making the snarky comment. So, these were, and at 31, I decided I had had enough of that. I said, I cannot live this way anymore. I fired all of my doctors, all of these white male doctors. I fired all of them, replaced them with women. And maybe they didn't know exactly how to help me, but they were sure as hell interested in helping me. They said, listen, I don't know how to help you, but we're going to figure this out together.
Step number 1. So there we go. So I'm also just wondering, when do you feel like for people it's best for surgical intervention? Because as you were mentioning, it's not just around the uterus, around that area. There's like thoracic endometriosis. Like, I don't think people understand where it.
Like
I was a thoracic case.
Really?
I was a thoracic case. Yes, I had endometriosis in my lungs. Well, the right lung, and on my diaphragm as well. I was in a wheelchair because I could not breathe when I walked. And an interesting thing about thoracic endometriosis, specifically with us, our populations, for some reason, us Black folks, when we get thoracic endo, we seem to excrete more of that liquid than other populations. And like, that little space in between where your rib cage meets, when I would have my period, it would balloon up and I couldn't breathe. I could not breathe. I could not breathe because there was just so much fluid in my chest, and it was. And they don't believe us. We go to the ER, and they don't believe us. Aubrey-Ann Rogers, it's been a year since she's passed. Aubrey-Ann Rogers, her story is just like so many of us. We were so heartbroken at the loss of Aubrey-Ann Rogers. She went to multiple ERs, was sent away. No one believed her and her pain. She had to go into emergency surgery, as many of us do, and she died on the table. She left behind her husband and a young son. And they have to live the rest of their lives without her. because people didn't believe her. I cannot tell you how many times I've been to an ER, told them that I was in excruciating pain, asked what my medical history was. They heard the word endometriosis and their eyes glazed over. Women too, female doctors, I've had that, like, they don't care. You go into they do not care. And they don't think it's important. But to answer your question about when is surgical intervention, when's a good time, it's a difficult question to answer. You want to go in as soon as possible. Surgery in teens is hotly debated because a lot of their endometrial, like they call it like baby endo, it's so tiny, it's likely you'll have to have a second surgery later on in life. But it's important because it's deleterious to your health to let endo sit on your organs. I lost my appendix. Many of us do. When I lost my appendix, I literally felt it burst in my side. I went to the ER. I didn't want to go because I didn't have insurance at the time. My family had to beg me to go. I went. They gave me a little bit of pain meds and sent me on my way. I then spent 2 years trying to find doctors who would pay attention to me. And I didn't realize that it was my appendix that had burst. When Dr. Sonervo opened me up, I had been walking around with a burst appendix for 2 years. And had I had surgery earlier in life, I could have prevented that. Marilyn lost her gallbladder, her appendix, and part of her pancreas. You can lose your kidneys because sometimes endo will wrap around your uterus, right? So there's your bladder, and then there's those 2 tubes that lead up to your kidneys. Those are called your uterus. Endo loves to squeeze them, and it causes renal failure. It causes kidney death. You need the earlier the better to have it removed. Is it unfortunate if you have to have a second surgery? Yes, it's not. You don't want to go into another surgery, but you'll have a better quality of life. You're less likely to lose organs. So I guess the answer to that question is, as soon as it's found, have as much as possible removed. Go to a good surgeon, a proper excision surgeon, skilled, who does high volume, only deals with endometriosis. Have it properly excised, not ablated, not burned, as soon as you can in order to save your organs. And while we're talking about expert excision, there are 200 million people on Earth who have endo. Approximately that number. There are only a little over 200 proper excision surgeons in the world. Excision care is not accessible.
So then it becomes a question of treatment. And so what does that look like?
There are no good endo treatments, honestly, because anything you're doing that's not excision surgery is simply dealing with symptom management. And while there's certainly a place for symptom management, and maybe you need to save up your coins because excision surgery isn't cheap, it's not covered by insurance, which is a whole different conversation. So a little bit of acupuncture, maybe some birth control pills, maybe some herbal remedies, a lot of painkillers, cannabinoids, a lot of magnesium. There are a lot of different things you can do to take the edge off, and they do have their place, like while you're managing your symptoms to get to surgery. But at the end of the day, you need to get surgery, because none of these things are going to stop the progression. I guess now is the appropriate time to talk about Lupron and Oralis and all the other GnRH antagonists. So these are essentially castrating drugs. This class of drug was originally formulated to treat cancer in men, later on used to chemically castrate male pedophiles, and is currently used to put you into a chemical menopause in order to stop your endo. The companies who make it admit that it will only help you with endometriosis-related pain. There is a myth amongst medical professionals that think it will stop it from growing, it'll stop progression, it will shrink lesions. It doesn't do any of those things. The companies who make it admit that. And for those who do receive pain relief from those drugs, It's only about 13% of people get symptom relief from that class of drugs. And the side effects are lifelong. Even if you only do one round of Lupron, you'll have bone density problems, you'll have issues with your hair, you'll have issues with your teeth, you'll have issues with your kidneys, you'll have issues with your liver, and those problems do not go away. You will also lose part of your ovarian reserve and you'll never get it back. But the lobbyists for AbbVie, who makes Lupron and Orilissa, have a lot of power. They have the ear of ACOG, the American College of Obstetricians and Gynecologists, and they get to control the narrative.
Yeah.
And I'm not like some conspiracy theorist against big pharma. Pharmaceuticals definitely have their place, but this one does not.
I get it. So tell us, what tips do you have for those who are dealing with similar symptoms to advocate for themselves?
So the first thing I would do is get as educated about endo as you can. There are lots of amazing resources. The Endometriosis Coalition is great. Endo What, who has Below the Belts coming out. The Endometriosis Summit is very good. The Center for Endometriosis Care, where I had my surgery, Center for Endometriosis Care, has a lot of wonderful information on their website. Nancy's Nook is a Facebook group, also has a lot of very good information. Educate yourself so that you can speak intelligently about your problems to the doctor. They will take you more seriously. Number 2, be firm, be respectful, but do not let them don't let them bully you. Don't let if you feel you need a test, if you want more work done, you're like, I need an MRI, I need an ultrasound, please do this. If they refuse, have them chart it. Say, okay, I asked for this, but you're refusing to me. Can you please make sure there's a note in my chart that you refused my request? If they are still combative with you, like I said, fire him. Find a new doctor, even if they're not an endometriosis, specialist, because they're few and far between. You need your general care to be with people who believe you. Then you need to find the closest excision specialist to you. Sometimes the closest excision specialist to you isn't the best one for your situation. For me, even though we have a couple pretty good surgeons here in New York, Dr. Vidali, I had to go to Atlanta. Why did I have to go to Atlanta? Because I was a thoracic case. And at the time, Dr. Cernervo was the place, and still he is the top, endo doctor in the world, and he's especially the top for when it comes to thoracic cases. Vidali does do thoracic cases now, but at the time he was very new. He'd only done 4, and Dr. Cernervo does. You're welcome. That was my nephew. Dr. Cernervo does 4 thoracic cases a week. So that's why I went to him. It was important for me to go to him. Thoracic surgery is not something to trifle with. I have a friend who's in California right now who did a thoracic surgery, and she had severe complications after because they didn't automatically do a chest x-ray after the surgery. They did it before she was discharged, but 1, they didn't even keep her long enough in the hospital, and 2, they didn't do any follow-up studies a week out. At the CEC, before you're allowed to leave the state, you have to do follow-up with them, and that includes chest x-ray to make sure you don't have any fluid in your lungs, you don't have any fluid in your chest. You have to get cleared. They didn't do any of that stuff. I heard her. She called me. She said, listen, something's going on. And I'm like, you're wheezing. You have lung crackles. There's fluid in your chest. She talked to them twice. They said, no, nothing's wrong with you. You have a cold. She just spent a week in the hospital because she had 2 liters of fluid. So you have to be very careful where you go. If you need help getting access to a good surgeon, speak with a patient advocate. Speak with someone who knows what they're doing before you go in. Make sure you vet your surgeon. How do you vet your surgeon? Have they done a MIGS program? Minimally invasive gynecological surgery. Have they done a MIGS program? Have they done a fellowship underneath an endometriosis specialist? Are they in a high volume endometriosis program? Do they do births? If they are giving birth to babies, this is not the doctor for you. They are not spending enough time with endometriosis. They're not going to be able to visualize and identify subtle endometriosis lesions. You need someone who only does endo, not someone who does a couple surgeries here and there. So that's those are the top ones. And then once you've done those, ask what's your recurrence rate. Dr. Sonervo's recurrence rate is 2%. If they're doing endosurgery and they're doing multiple, like 10 surgeries on a person, you have to question it, which happens a lot. This is not an uncommon thing.
Right.
This is not an uncommon thing, especially if they're not a skilled excisionist and they're only excising some things and they think other things are too dangerous to touch and they ablate them, they cauterize them, they burn them. They don't know what they're doing. If those listen to those keywords. Oh, you have it on your bowel, that's too dangerous to touch. Oh, you have it on your diaphragm, that's too dangerous to touch. That means that their skill level is lacking. You need to see a different surgeon. Do not gamble with your body.
So now that you've had your surgery, would you consider yourself like on the other side of endometriosis? How has like your healing process been?
So yes and no. While excision surgery is the gold standard, there is no cure. And there's a, because I'm a thoracic patient, there is a possibility I might need to do another surgery in 10 years, which I'm okay with. But right now I'm doing amazing. I'm 4 years out. I have painless periods, which is not something which now that I know what a period is supposed to be or can be, I can understand why folks who had that don't understand and thought, oh, she's being dramatic. I have 3-day periods. I used to have 10, 12, 14-day periods that were excruciatingly painful, caused me to not be able to breathe, blackout pain, fevers, like vertigo, all kinds of crazy symptoms that you wouldn't think are related. I used to get vertigo so often. I had vertigo once a couple weeks out of surgery, and I haven't had vertigo since. Like, the amount of things that are inside my arms and legs used to go numb. And my old gynecologist told me that the reason that my arms and legs were going numb was because I had anxiety. He told me I had anxiety. I used to have nosebleeds on the first day of my period because I had the thoracic endo. He goes, oh, the air in your house is dry. 1 day a month? Homie, make it make sense. The math ain't mathin'. You know what I mean? So
it would be just
I'm in an amazing place right now.
I don't know.
But their ego is too big. If they don't understand it, it means it doesn't exist. There are a lot of doctors like that. If they don't understand what you're talking about, it must mean that you're making it up. It's in your head. You're a hypochondriac. You're hysterical.
You're not lying.
So while I'm doing very, very good right now, and I anticipate to be continuing to do well in regards to endometriosis anyways. Long COVID is a different story. But in regards to endometriosis, I'm doing amazingly well. And I anticipate to continue to be doing amazingly well because I had an amazing surgeon. Will endo rear its ugly head sometime in the future? It's possible. Like I said, excision is not a cure. It's just the gold standard. It's the best we have right now. So there's a possibility in the future Alysia will have to deal with endo again. But in the meanwhile, while I'm doing good, I'm going to go out. I'm going to help people.
And where can people find you? Let the people know.
Okay. So where can people find me? You can find me on Instagram, Tantielys, TANTIELYS. And right there is the link. The link in my bio has all the articles I've been in, all my upcoming events. Speaking of upcoming events, right here in Brooklyn, we are going to be doing an exclusive screening of Below the Belt, which is the new documentary by Miss Shannon Cohn, my dear and lovely friend. A lot of my friends are actually in this documentary. I'm super excited. We're going to be doing ours at the Stewart Cinema and Cafe in Greenpoint. And please believe this is the blackety black screening of Below the Belt. We're going to be turning out. So I hope to see all of you there. And if you're not there, keep an eye on my Instagram. And Natalie too, my partner in crime in this screening, Endo Cipota. She's representing for the Latinx community, and we're gonna have lots of stuff in store for you guys.
I love it. I love it.
We're gonna have a yellow curtain.
Do it. I'm
Go ahead.
so gonna be yellowed out for when I post.
Yes.
When we post this episode, everything is just gonna be yellowed out.
Yes, we love your passion and your advocacy. It could have been very simple for you to get the treatment that you get and be thankful and make a post or two, but you are part of a community and, just pushing for the rights and the voice that needs to be heard and the information to be out there. So, we are grateful for your knowledge and for coming on with us and letting us know. I learned a whole lot, Ashley. I don't know about you, but my mind is blown. I feel like I need to do some research, but thank you so much.
Yeah. So we hope you guys enjoyed this episode. Please like, comment, subscribe. Please look into it more, as well. So yes, everyone, till next time.